now you're able to use the thing that interacts with the world, right? I don't go around doing things with my elbows. I go around doing things with my hands. And so if we give you improved function about your hands and your wrists, you're more likely to interact with the environment more.
Hey everyone, my name is Dr. Nick Halsey with Motus Nova. I'm a licensed neurophysical therapist and neuroscientist helping brain injury survivors understand how to make functional gains after their injury. I hope this video helps you in your recovery.
I think Donna had asked a great question inside the chat.
Sure.
Robotic focuses on the foot and also the hand, but does that, neuroelasticity, transfer up, to the arm and to the leg?
Sure. Yeah, this is another important one. I think when it comes to this idea of improvements, we'll call it generally the generalizability framework. I've used the term to define the term there. That's okay. The truth be told is we were actually really surprised when we looked at the evidence of the trials, the data from the trials. And you guys are exactly right. The hand mentor, the Motus hand, is targeted at the wrist and the individual hand, right? And so one would expect to see improvements in hand function and wrist function. And indeed we do. That is in fact true. But what's really interesting is we saw improvements in motor control in tasks that require elbow and shoulder control as well. And that was a bit surprising to us, simply because, there's this concept in training and periodization and rehab called specificity, meaning if you train something specifically, like if I really practice hard on being able to open and close this bottle, I'm going to be really good at training and to open and close that bottle, but maybe not something that's related to it, like opening up a jar, right? A larger jar with maybe a larger aperture. But when it comes down to these interventions, we did see those improvements were more generalizable than we anticipated, which is a happy consequence, meaning people, even though we were just doing these tasks about the wrist and the hand, saw improvements in the elbow and the shoulder. And there's a couple of reasons why we think this is the case. We haven't tested it explicitly, but there's a neurophysiologic example of why this happens, or underpinning. And then there's an actual functional reason why this might be happening. The functional reason is if we give you control, better improved range of motion because you're having reduced tone and spasticity, and now you have better control over your hand and your wrist, now you're able to use the thing that interacts with the world, right? I don't go around doing things with my elbows. I go around doing things with my hands. And so if we give you improved function about your hands and your wrists, you're more likely to interact with the environment more. And that requires you to use your elbows and your shoulders more. So there's this kind of positive feedback loop of getting some functional control over your distal extremities, the wrist and the hand. And that leads to the spillover effect up the chain.
Hey, if you're finding this video helpful, please hit like and subscribe to help other brain injury survivors learn how Motus Nova is changing neuro-rehab.
That's the simple example. The more complex example is actually taking a deep dive into how the circuits are constructed in our brains and our nervous systems. And it turns out that when you do these studies, if you do activations in the wrist and the hands, there actually is synchronous activation of the whole functional unit. And so probably what's happening is we're doing a lot of repetitive task practice that's engaging these really specific parts of the brain in the wrist and the hand that's causing activation and rewiring up the chain. So we probably believe these two things are interacting to cause these improvements. And that holds true for the lower extremity as well. We just have a lot more data of the upper extremity. And so when we do these same sort of interventions in the lower extremity, we see improvements in the strength and range of motion of the foot that are really in sort of the fundamental building blocks to gait, meaning how fast you can walk is directly proportional to how hard you can push off, which is basically you're controlled by your calf muscles. And also the ability for you not to trip and fall is controlled by those muscles that we work as well with the Motus foot as well. So there's a lot of corollaries there in the upper and lower extremity. Hopefully that helps to provide some insight for you, Derek.
Yes, very much so. Thank you.
Okay. Yeah, of course. Any other questions for me? Hopefully that helps.
That's all I've got so far. The one about the Botox was interesting. So are people using the Botox in addition to this robotic technology?
Yes, they are. There are a number of individuals who are using combination of these things, whether it's baclofen or these targeted interventions where they're doing local injections. Now, of course, that needs to be directed by your medical team, or in this case, is the family's medical team. So I think that's a good question to integrate into the whole medical sort of establishment that's taking care of him. But yeah, generally speaking, it's a good idea to do these sort of multimodal approaches.
Okay, thank you.
Of course, yeah.
Thanks for watching this video. If you have questions or would like to speak with me about how you can make functional gains from home, call or text me at 404-939-3476 or visit motusnova.com/contact.